Have you ever woken up in the middle of the night, clutching your pillow, and asked yourself, do I even have enough time to see my grandkids grow up? If you have, then today's story is for you. This isn't some dramatic exaggeration. It's your body's warning that far too many of us only hear too late. I'm a seasoned doctor, over 60 now, with more than 3 decades in the clinic, and I want to tell you straight, those moderate blood pressure numbers, 115/75, 125/80, aren't always harmless. In fact, the Framingham Heart Study, one of the cornerstone studies in cardiovascular medicine, shows that the risk of vascular damage starts increasing at these seemingly safe levels. And with every 20 millimeters of mercury rise in systolic blood pressure, the risk of stroke, heart attack, and kidney failure doubles. In other words, today's small wave can become tomorrow's storm. I want you to imagine this. Your heart is like an old bridge crossing a river. Every day, thousands of vehicles, your heart beats, pass over it. Blood pressure is the weight pressing down on that bridge. If the number is slightly higher, each vehicle leaves tiny cracks. Over time, those cracks join together, and the bridge, your blood vessels, weakens. You don't see the cracks, but one day the bridge could fail. That's why we can't ignore numbers that are not yet in the red zone, but keep repeating. I remember James, a 58-year-old man, an avid weekend cyclist who always felt healthy. One morning, his wife insisted he get checked. 128/82. Come on, doc. My friend's 150 and feels fine, he said. 3 years later, James ended up in the ER with chest pain. Looking back at his records, I saw a chain of moderate numbers no one paid attention to. Not from ignorance, but from a habit of postponing, believing everything would be fine. That's the story of many. Feeling well tricks us, while the vessels silently suffer. So, how do we avoid being fooled by that feeling? First, understand one key thing. Blood pressure isn't a solitary number. It's part of a bigger picture: age, diabetes, kidney health, family history, weight, sleep, and daily lifestyle. The same reading of 134/84 can be a red flag for Mr. Raj, 65, with diabetes and smoking history, but relatively harmless for Ms. 90, 34, healthy and active. That's why I always tell patients, don't just ask if this number is normal. Ask if it's safe for you. From a clinical perspective, the evidence is clear. Risk increases gradually, not suddenly. Framingham shows that from 115/75, risk is already climbing. And in people with underlying conditions like diabetes, vascular damage can appear even earlier, sometimes at 125/80. That's why treatment must be risk-based, not just number-based. When I review an older patient's record, I don't just look at numbers. I look at the person behind them: diet, sleep, alcohol or tobacco habits, physical activity, social support. Those factors guide whether early medication or lifestyle changes are needed. Have you ever noticed your blood pressure reading is higher at the clinic than at home? That's normal. It's called white coat effect. Your heart races in the doctor's office, just like nerves before an interview. I had a patient, Ellen, 72, who was told for a year that she needed medication because her clinic readings were always around 150/88. When she learned to measure properly at home, sitting quietly for 5 minutes, arm at heart level, morning and evening readings, her true numbers were 128/76. She cried when she realized her anxiety was driving the spikes, and we avoided unnecessary medication. Ellen's story reminds us that how we measure matters, and quality data leads to the right decisions. But don't misunderstand. Waiting until 140/90 is not a safe strategy. Imagine a leaky roof. You wouldn't wait for the ceiling to collapse before patching it. Blood pressure is like that drip. Early interventions, reducing salt, cutting processed foods, walking 20 to 30 minutes daily, getting enough sleep, losing a few pounds, are small patches with big impact. And if you have risk factors, over 60, diabetes, kidney disease, history of heart attack, your target blood pressure may need to be tighter. Sometimes around 125/75 is safer. I want to ask you something. What small step are you willing to take today to increase your chances of waking up healthy next year? A small thing, measuring your blood pressure properly tomorrow morning, keeping a record, and bringing it to your doctor, or starting a 10-minute morning walk. These small steps may seem insignificant, but they lay the foundation for brighter mornings ahead. Finally, remember this simple yet profound truth. Blood pressure isn't the enemy. It's your early warning system. Listen to it, understand it, and act based on your personal context. Don't let moderate numbers trick you into thinking everything is fine. Turn those numbers into a story about mornings you wake up healthy, about grandchildren you'll hug, about years spent savoring the small joys of life. In the next video, I'll guide you step by step on how to measure blood pressure at home and interpret the logs with your doctor to set your personalized goals. See you then, and if you're listening right now, take a deep breath and make a small promise to yourself. Measure your blood pressure tomorrow morning. You deserve it. Now, let's dive a little deeper into the story of the person behind the number. You might be asking yourself, if my blood pressure is 134/84, should I worry? The answer isn't in the number alone. It depends on you, your age, underlying health conditions, lifestyle, family history, sleep habits. All of it combines into the bigger picture. I want you to imagine this. The same blood pressure reading, but two completely different stories. Mr. Raj, 65, with diabetes and a long history of smoking, measures 134/84 one morning. For him, this is a red alert, like a house with small cracks in its foundation. If ignored, those cracks will spread, and sooner or later, consequences appear. Heart, brain, and kidneys all at risk. Mr. Raj may need early intervention, sometimes medication, sometimes lifestyle changes, to prevent that hidden storm from striking. Meanwhile, Ms. 90, 34, slightly overweight but otherwise healthy, has the same reading of 134/84. For her, it's just a gentle reminder. Cut back on salt, move a little more, keep monitoring, no medication needed yet. She feels well, her mind sharp, her energy steady. The difference is the person behind the number. I call this risk-based targeting, treating not just the number, but the person. I've seen far too many middle-aged and older adults told, "Don't worry about it," based on a single reading, only for their hearts to speak in a harsh language later. Heart attack, stroke, kidney failure. Another striking study from The Lancet on Indian adults showed that people with diabetes already had early vascular damage at 125/80, much lower than what many consider pre-hypertension safe. Blood pressure is silent. It wears down your vessels slowly, like rust inside a pipe. You don't hear it, you don't see it, until one day the consequences appear suddenly. So how do we define a safe level for ourselves? This is where the doctor's role becomes critical. Not just following charts or general standards, but looking at your entire health profile, age, family history, lifestyle, and the signals your body gives you. I often tell my patients, we're not treating blood pressure, we're treating you through your blood pressure. Have you ever wondered, why do I feel fine, yet the number is slightly high? That's exactly why. Feeling well doesn't always mean your blood vessels are in perfect shape. And conversely, low blood pressure without symptoms isn't automatically ideal. What matters is whether your body is receiving enough blood, oxygen, and nutrients. In the next part, I'll guide you on how to read your blood pressure correctly at home, track it, and keep a proper log so you truly know where you stand, instead of guessing or relying on inconsistent readings. Once you understand your personal picture, you can create a plan to control your blood pressure effectively, safely, and sustainably. Are you ready? Let's step into a simple yet powerful routine, where each morning and evening, you truly take control of your own health. Now, I want you to imagine something. You've just checked your blood pressure at home, and the reading pops up, 138/86. You breathe a sigh of relief, thinking, oh, it's not 140, I'm fine. But I want you to pause for a moment and reflect. Fine for whom? For you or for the standard numbers on a chart? Blood pressure isn't a standalone number. It's more like the rhythm of your life. It reflects your meals, your sleep, stress levels, activity, and even your family story. I remember a patient, Mrs. Linda, 62 years old, with diabetes, consistently around 134/84. She always thought that number was acceptable. But once I explained that even at this level, with her diabetes history, her blood vessels were quietly starting to suffer damage, she began making small daily changes. cutting salt, walking every day, managing her sleep. Within just a few weeks, her blood pressure stabilized, and most importantly, she felt more energetic and mentally sharp. Here's the key point. The same blood pressure number can tell two completely different stories depending on your health context. Mr. Raj, 65, a smoker with diabetes, at 134/84 is a red alert, while Ms. 90, 34, healthy, sees the same number as a gentle reminder. That's why I always tell my patients, don't just look at the number. Look at yourself behind that number. From a scientific perspective, the evidence is clear. Risk rises gradually, not in sudden jumps. The Framingham study shows that risk starts increasing from 115/75. And for people with underlying conditions like diabetes, the risk appears even earlier. This reminds us that waiting until 140/90 to act is often too late. Have you ever heard of the white coat effect? Many people see higher readings at the doctor's office and panic, thinking they're in serious trouble. A patient of mine, Mrs. Ellen, 72, was constantly told she needed medication because the office machine repeatedly read 150/88. When she learned to measure correctly at home, sitting quietly for 5 minutes, arm at heart level, checking morning and evening, her true numbers were just 128/76. She cried, realizing it was the anxiety at the doctor causing the higher readings. From then on, she didn't need immediate medication and learned to manage her blood pressure herself. This leads to an important principle. Measure correctly, keep a log, track trends. That's the real key. Not a single reading, not the number at the office, but your long-term picture. When you understand the trend, you and your doctor can decide when intervention is necessary and when lifestyle adjustments are enough. In the next part, we'll explore how to read and log your blood pressure at home so you truly understand your personal picture. I'll guide you step by step with simple, effective techniques so the numbers no longer feel mysterious or stressful. Instead, they become tools to protect your heart, brain, and kidneys. Are you ready to take control? Let's keep moving forward, because every number you record today is a building block for a healthier tomorrow. Now, let's talk about how blood pressure affects your body over time, and why you can't just glance at a single number and feel reassured. I want you to imagine this. Your body is like a network of water pipes, and blood pressure is the pressure of the flow inside. If the pressure is even slightly high, each drop slowly wears down the pipes. At first, you don't see it, you don't feel it, but over months and years, those tiny abrasions accumulate, and one day, a pipe may leak or burst. Your body works the same way. The blood vessels in your heart, brain, kidneys, and eyes endure daily pressure, quietly sustaining damage long before any symptoms appear. I had a patient, Mr. Michael, 67, who consistently measured around 135/85. He felt healthy, walked every morning, and participated in his chess club. But when we performed a vascular scan, I discovered small plaques forming in his coronary arteries. "But I still feel fine, doctor," he said. And he was right. Feeling well doesn't always reflect the reality inside. Those moderate numbers can be early warning signs invisible to the naked eye. This brings us to an important concept. Blood pressure isn't a fixed point. It's a process. The risk increases gradually. It doesn't suddenly spike at 140/90. It's like a slippery slope. You don't notice yourself sliding, but each small step nudges you further down than you realize. And in many cases, even younger, healthier people aren't immune. If you have diabetes, high cholesterol, or a family history of heart disease, your vessels may already be sustaining damage before your blood pressure reaches an alarming level. That's why understanding your personal blood pressure trends matters far more than comparing yourself to others. I always tell my patients, don't worry about your neighbors' or friends' numbers. Focus on yours in the context of your own health. When you grasp the full picture, you can make the right decisions. When to adjust lifestyle, when medical intervention is needed, and most importantly, when both are necessary. In the next part, we'll explore how to accurately measure your blood pressure at home, track trends, and turn those numbers into a powerful tool to protect your heart, brain, and kidneys. When you know exactly where you stand on that slippery slope, you can steer in the right direction, avoid unexpected storms, and maintain sustainable health. Are you ready to take the next step? Let's go through practical, step-by-step methods so that each morning you wake up knowing you are on the right path and your heart remains strong, silently yet steadily. Now, I want to talk about an aspect that many older adults often overlook: low blood pressure. Many patients come into the clinic worried, saying, "Doctor, my mother's blood pressure is 90/60. Should we rush to the ER?" Or they ask themselves, "I measured 98/60. Is that okay?" This is when we need to look at the person, not just the number. Low blood pressure, when it comes without symptoms, is often a sign of a healthy body, especially in younger individuals, those who exercise regularly, or people with naturally strong circulation. I once cared for a patient, Mrs. Susan, 55, whose blood pressure was consistently around 95/60. She walked 5 kilometers every day, ate well, and was full of energy. She didn't need medication or medical intervention. In her case, the low number was just her body's unique rhythm, completely normal. But if low blood pressure comes with symptoms, dizziness, persistent fatigue, lightheadedness when standing, or even fainting, then it becomes a warning. Low blood pressure is no longer fortunate, but a problem that needs investigation. Causes can vary widely, from medication overuse, dehydration, irregular heart rhythms, to autonomic nervous system issues. I treated a 68-year-old gentleman with a blood pressure of 88/56, who constantly felt weak and dizzy. After proper evaluation and medication adjustments, his condition improved significantly. This teaches an important lesson. Blood pressure is not inherently good or bad. It's about what's appropriate for your body and health context. Our goal isn't to reach the lowest number or to avoid the highest. It's to maintain a blood pressure that delivers enough oxygen and nutrients to your heart, brain, and kidneys, so you feel alert, energetic, and safe. And here's the point I want to emphasize. Understanding your body, tracking your blood pressure, and noticing early symptoms, that's the real key. There's no need to panic at every reading, but don't be indifferent either. Because whether high or low, blood pressure can quietly cause damage, leaving marks you only notice when it's too late. In the next section, we'll discuss how to set personalized blood pressure goals based on your age, medical history, and lifestyle, so that every number you record truly matters and supports long-term health. Are you ready to understand your own personal number? Let's continue, because your health deserves careful, thoughtful attention. Now, let's talk about setting personalized blood pressure goals, and this is a crucial part that many people often overlook. I want you to imagine this. Each of us has our own health picture, and blood pressure is just one part of that canvas. Your blood pressure goal shouldn't be based on your neighbor's numbers, a friend's reading, or a general guideline from a chart. It must be based on you, your age, medical history, lifestyle, and even family background. I often meet older patients who ask, "Doctor, I'm 70. My blood pressure is 130/85. Should I be worried?" For a younger, healthy person with no underlying conditions, that number might just be a gentle reminder. But for someone over 60 with diabetes, kidney disease, or a history of heart problems, the same number is a red flag. I call this risk-based guidance. It's not about treating a number, but treating the person behind the number. Here's a real example. Mr. Thomas, 68, had a heart attack several years ago. His blood pressure usually ranged from 136/82. If we only looked at the number, we might say, "That's fine." But considering his age, cardiac history, and other risk factors, his blood pressure goal needed to be tighter, around 125/75, to protect his heart, kidneys, and brain. After a few months of proper medication combined with lifestyle adjustments, his blood pressure stabilized, and his risk of another cardiovascular event dropped significantly. For younger, healthier patients without risk factors, the goal range can be broader, but action is still required. Regular monitoring, healthy eating, physical activity, adequate sleep, reducing salt intake, and managing stress. Small, consistent changes yield lasting results. I emphasize this. Inaction is the real enemy. Waiting until you cross 140/90 to act is like waiting for a roof to start leaking before fixing it. Too late, too risky. One question I often ask my patients: what are you willing to do today to protect your health over the next 5 years? Blood pressure is the answer, but it's an answer you can influence. Every morning, measure properly, track your trends, adjust small habits. All of these contribute to your own safe health picture. In the next section, I'll guide you step by step on how to measure your blood pressure at home, keep a detailed log, and read the numbers so you truly know where you stand on your own health slope. When you understand this picture, you take real control instead of letting a number dictate your future. Stay with me, because your health deserves to be cared for intelligently and with genuine love. Now, let's talk about a challenge almost everyone faces: blood pressure fluctuations and why you shouldn't rely on a single reading. I want you to imagine this. You measure your blood pressure at the clinic, it shows 145/88, and your heart skips a beat. But when you get home and measure again, it reads just 128/78. You wonder, is the machine broken? Or am I imagining things? In truth, both explanations are correct in their own way. Blood pressure is not a static number. It changes over time with posture, stress levels, even the coffee you drank or how you slept the night before. I once cared for Mrs. Ellen, 72, who was constantly anxious because her readings at the clinic were always high. When I guided her to measure properly at home, sitting still for 5 minutes, arm at heart level, morning and evening, her numbers stabilized and were much lower. She cried when she realized that her anxiety itself was driving her blood pressure up in the clinic. This teaches a valuable lesson. Look at trends, not a single number. Keep a log, measure correctly, observe both high and low days. That's the true picture of your body. When you understand these trends, you and your doctor can decide when to intervene and when simple lifestyle adjustments are enough. Here's some advice from years of experience. Never compare your blood pressure with someone else's. Friends, neighbors, even numbers you see on social media, they are just references, not standards for you. The critical thing is knowing what blood pressure is appropriate for your health, age, and individual risk. In the next section, I'll show you how to turn your home blood pressure monitor into a truly useful tool, rather than a source of anxiety. I'll guide you step by step, from choosing a device, proper posture, to logging and evaluating trends. When you master this skill, every reading becomes valuable information, helping you protect your heart, brain, and kidneys proactively, not reactively. Are you ready to turn blood pressure into a tool to manage your own health? Let's continue together, because every minute you understand your body is a minute spent building a healthier future. Now, let's talk about how to use a home blood pressure monitor, a step that many viewers often overlook, which leads to unnecessary confusion and anxiety. I want you to imagine this. You've just bought a digital blood pressure monitor, feeling excited, but after a few readings, the numbers jump all over the place, and you ask yourself, is the machine broken? Or is it me? The truth is, the machine isn't broken. It's how we use it that makes all the difference. I've guided countless older patients, and the pattern is always the same. Incorrect posture, measuring right after walking, drinking coffee, being stressed, or not resting for 5 minutes before the reading. All of these factors can make the numbers higher or lower than reality. So, how do you measure correctly? First, sit quietly for at least 5 minutes before measuring, arm at heart level, feet flat on the floor, back supported. Don't talk or look at your phone. Second, measure at the same times each day, ideally morning and evening, so you can track trends rather than focusing on a single reading. Third, keep a careful log, date, time, numbers, and how you feel. When done correctly, your home monitor becomes a powerful tool, not a source of worry. I remember a patient, Mrs. Martha, 70, who was initially anxious because her readings at the clinic were always high. Once she learned to measure properly at home and keep a log, she realized her blood pressure trend was much more stable. This eased her anxiety and, most importantly, allowed us to know when intervention was truly needed and when simple lifestyle adjustments were enough. These steps may seem small, but they make a big difference. When you understand your blood pressure trends, you know where your body stands on the health slope, whether you're on the right path or need to pause and adjust. Each number you record becomes a tool to protect your heart, brain, and kidneys. In the next section, I'll summarize everything we've covered, from understanding blood pressure, reading trends, setting personal goals, to measuring correctly at home. Once you master this entire process, you'll truly take control of your health, instead of letting numbers decide your future. Stay with me, because your heart, brain, and kidneys deserve to be cared for wisely, proactively, and with love. And finally, I want us to take a step back and look at the bigger picture. Blood pressure isn't just a single number. It's your story, your age, medical history, lifestyle, family, and even how your body feels. It may fluctuate, but if you know how to track it, understand the trends, and set personal goals based on your real risk, you can actively protect your heart, brain, and kidneys. Imagine waking up each morning, measuring your blood pressure correctly, logging the trends, and seeing that you are on the right path. You feel reassured, energized, and confident that you're proactively preventing silent risks without obsessing over every little number. That is the power of understanding and managing blood pressure wisely. One of my patients once shared, "Doctor, I used to worry with every reading, but now I feel confident and at peace. I know I'm taking care of my body the right way." That story reminds me that health isn't just numbers on a machine. It's the peace of mind and proactive care you give yourself. So today, I want you to start right now. Not from 140/90, not from the next scare. Start by understanding your body, tracking trends, and setting a blood pressure goal that fits you. Ask yourself, am I truly in control of my blood pressure? If not, begin today. If this video has given you value, hit like, share it with loved ones, especially your parents, grandparents, or anyone you care about. And don't forget to subscribe and turn on notifications so you don't miss the next essential tips to protect your heart, brain, and kidneys intelligently and proactively. Take action today because your health cannot wait, and every small step you take now becomes a solid building block for a healthy future for yourself.